when you're having a really hard day and you feel like, oh, like, the task is insurmountable, and you have to take that deep breath in, what is it that keeps you motivated? What keeps you going? What makes you happy? Even when you're tired, and even when you feel like you're close to the edge and saying like, oh, this seems impossible. What is it that kind of, just kind of keeps you going?
When I'm, at my absolute worst, I just have to walk down the hall, and I just have to talk to my staff member, my office manager, who was hospitalized with COVID. And I think, what if we had lost her? I have a human being down the hall who is my inspiration to just shut this thing down.
People forget that as physicians, and we took an oath. I'm looking at a camera right now, and if you were in my office and see what I see outside of the screen on the wall, the Hippocratic Oath hangs to the left of that screen. It's always guided me. It's guided me as a physician. It's guided me as a CEO. My motivation comes from the promise I took when I graduated medical school.
So, I mean, I have the best job in the world. I get to work and play and talk with children all day long, whether they're 4-month-old babies who smile at me, or, a great, 7-year-old who's going to tell me what they did in school, or the 17-year-old who's, getting ready to pick which college they want to go to, or at least want to visit. So that's, what keeps me going every day in pediatrics, whether there's a pandemic or not.
And so once this is kind of, once we can get there, when we can move past this and it's kind of not such a urgent situation, what are you looking forward to the most?
I have, personally, I have a very simple reason. I need this thing done. I lost my beloved father in December. We have not been able to gather as a family to celebrate his life. And that we knew we were not going to travel and get together until we all felt, safe doing that. So
Right.
That's finally going to happen. I had to answer this question in a less formal way the other day, and it was hugs.
Yeah.
It was hugs. But I'm looking forward to just being with people again. I love theater. I want to go into theater again. I haven't done that. Haven't eaten in a restaurant yet.
I'm looking forward to eating in restaurants without having to think about, should I wear a mask or not, or all those protocols. My wife and I have been still patronizing our favorite restaurants in town, but we have been doing it through takeout and not through dining in. And I think now that the CDC mask rules have come out, we are really close to deciding we're going to do a date night out and not in our living room again pretty soon. Looking forward to just, normal things that get us all through the summer, music festivals and parades and all those kind of things that, when they can all be done without any kind of worry or fear that we're spreading infection around, that'll be great.
I really look at, what we've learned in the pandemic. Let's just take up how many people qualified for the vaccine because they had an underlying health problem in the state of Wisconsin. Somebody's like, well, that's 80% of the state. We have a problem if 80% of our state has an underlying health problem. We need to be healthier. We need to have a focus on health. We can't just always focus on times when we're sick. We need to be stronger. We need to be nicer to each other. We need to come together, back together as a community, take care of each other. And I'm really worried about everybody's mental health. Like I said, it's been a traumatic year. And I want to make sure that everybody has access to good mental health going forward. Processing the last 15 months, for some, it'll only take a few months to get over it. For some, it'll take a lifetime. And I want to make sure that help is there.